Hello everyone, welcome to this training video. Today I will guide you through a systematic workflow on how to quickly and comprehensively review AI-generated implant treatment plans and surgical guide designs. Although AI can significantly accelerate the design process, the final treatment plan still requires clinical verification by the clinician. Therefore, this session will cover 5 core components: data matching and tooth setup, implant positioning and system selection, sleeve compensation and surgical guide design parameters. We will review each item step by step. We begin with the most fundamental and critical step: data alignment review. After AI completes the initial alignment, we must confirm whether the CT and intraoral scan models are correctly registered. I recommend checking from 3 perspectives. First, zoom in and evaluate the matching details of each tooth crown. Check whether the incisal edges, buccal and lingual surfaces and gingiva match properly. The CT should fully coincide with the intraoral scan model, with no visible rotation or displacement. Second, pay attention to artifact areas, such as metal crowns or zirconia crown teeth. If artifacts appear in CT, switch views to ensure alignment remains accurate. Third, evaluate the entire dental arch to ensure no arch-level deviation occurs, such as left-right shifting or anterior-posterior tilting. Data alignment is the foundation of the entire design. Any misalignment will affect implant positioning and guide accuracy. After confirming the data alignment, we move on to prosthetic tooth setup review. Implant planning must always follow prosthetic principles. The quality of the prosthetic setup directly determines the correctness of the implant plan. When reviewing AI-generated tooth setups, focus on 3 points. First, verify whether the crown position harmonizes with adjacent teeth. In the anterior region, pay attention to arch form, gap size, and crown proportions. Second, open the opposing dentition to evaluate occlusion. Ensure there are no premature contacts, interferences, or complete lack of contact. If the prosthetic setup is significantly inaccurate, adjust it first, and then regenerate the implant plan. Next, we enter the most clinically important part: reviewing the implant type, position, angulation, and bone relationship. Review each item in a consistent sequence. First, confirm the implant system diameter and length match the surgical plan. Second, check whether the implant axis passes through the center of the prosthetic crown. A deviation affects abutment orientation and increases restorative difficulty. Third, evaluate bone safety margins. Ensure at least 1.5 to 2 millimeters between the implant and adjacent roots. Overly thin buccal bone may cause perforation or poor healing. Fourth, use multiple cross sections to verify implant depth. The implant platform typically should be 2 to 3 mm below soft tissue. Fifth, assess the proximity to critical anatomical structures. Avoid the inferior alveolar nerve in the mandible and evaluate sinus floor height in the maxilla. Each implant must be reviewed individually. This step is essential for surgical safety. After completing implant review, we proceed to sleeve compensation. Sleeve compensation defines drilling depth and drilling sequence. Confirm the sleeve model matches the implant system and that it fits properly within the edentulous space. Check the sleeve offset value. Offset equals drill length minus implant length minus drill key thickness if exists. Then we continue with reviewing surgical guide design parameters. Guide design directly affects the surgical experience and must be carefully evaluated. First, ensure the guide thickness is greater than 3 millimeters. Insufficient thickness may cause deformation during printing or surgery. Second, verify the support type. Tooth-supported guides need even tooth surface coverage. Mucosa-supported guides require broad support for stability. Third, ensure model offset and sleeve clearance settings match the 3D printer's characteristics. This directly affects intraoral guide fit. Fourth, check for thin walls, overhangs, or irregular protrusions. Make sure the guide can be printed reliably. 5th, confirm the drilling access path is clear and not blocked by adjacent teeth or guide structures. This ensures accurate and unobstructed drilling during surgery. After reviewing all components, we conduct a final check before export. Use the AI-generated plan report to verify accuracy. Confirm implant angles and depths. Check that the guide does not interfere with soft tissue or adjacent teeth. Ensure drilling paths are unobstructed, and verify implant models, sleeve models, quantities, and toolkits match the clinical setup. Once everything is confirmed, you may export the STL file or generate the surgical report. Finally, let's summarize. AI can significantly improve the efficiency of implant planning, but it cannot replace clinical judgment. The 5 review steps: data matching, prosthetic setup, implant evaluation, sleeve compensation, and guide design parameters form a complete and reliable review workflow. Following this checklist ensures every AI-generated plan is controllable, reliable, and clinically viable. Thank you for watching this training session. More content on digital implantology and intelligent design will be shared in future videos.